Good morning, everybody, and welcome to the 2Reach Final Conference. The theme of today is implementing and transferring innovations across health systems. Thank you so much for joining us. We've got 230 people registered to join us today and an incredibly impressive panel of speakers who will be sharing their expertise throughout the morning. I'm George Valiotis. I'm the Interim Executive Director at the European Health Management Association, and I'll be the Master of Ceremonies today. Today's focus is going to be the 2Reach project. And as you'll see on the slide here, 2Reach provides useful conceptual frameworks for research and innovation, supporting healthcare services and systems so that they become more resilient, effective, equitable, accessible, sustainable, and comprehensive in Europe, but also elsewhere. The consortium that made up 2Reach is 28 partners from 15 EU member states and 5 non-EU countries as well. We have 19 governmental and funding bodies, 6 national research organisations, 3 European level bodies. And in this way, for me, what's been quite exciting as one of the partners of 2Reach is that 2Reach is more than a project, it's been a real movement. And that's what you're going to hear from the speakers today. To give you a sense of the programme, just an overview, I'll let you know that today we're going to focus on the strategic research agenda. And what that does is it focuses conceptually and methodologically on learning from services and policy innovations and the conditions needed to transfer and implement these from one setting to another, both within and between countries. Now, surely as you hear me say that, that's conceptual, but today's speakers will help you really understand what this means and how this can benefit the work that you're doing. The agenda that will follow today, we'll start with the first session, Health Systems in Times of COVID. And after that, the next 2 sessions will focus on the policy briefs that are some of the main products of this work that you'll be able to take away with you. The first one is what are key priorities when studying service and policy innovations in health systems, which would be a 40-minute session. And then immediately following that, another 40-minute session about what do we know about transferring services and policy innovations between health systems. We're going to have a final session of what's next, so you can understand where this movement is going. And what I want to do now is move on to the first session. I'm going to hand you over to the moderator of this session, Josep Figueras, and he is the director of the Observatory on Health Systems and Policies, and he will take you through this amazing panel of speakers and their discussion. So, Josep, over to you.
Thank you, George. Thank you very much. What a pleasure for me, what a privilege for me to be here today at the conclusion of this very, very exciting project, and particularly to be facilitating these panelists. As we heard colleagues from George, 2Reach is all about the what do we put in our research agenda to support our member states, what are the key priorities, but as importantly, and I think is one of the key innovations of 2Reach, is the how. How do we transfer this evidence? How do we transfer this best practice from country to country? And how do we introduce innovation and transform health systems? And I'm very happy because we have 4 key stakeholders, key institutions, as it were, representatives, as it were. We have the World Health Organization, represented by its regional director. We have the European Commission with the head of unit who's been key in many of these developments and this support. We have the forthcoming Slovenian presidency with the Director General joining us today. And we have the academia, as it were, although Walter Ricciardi is not only academia, is not only a great researcher, but also some high-level civil servant who's been supporting member states with its evidence, its know-how. So in many ways, what I like today is not only we have these 4 key organizations, but key individuals. When you look, I'll be introducing them one by one as I ask them questions. Each one of them, if you look at their expertise and their experience and their CVs, they have this very much engagement on transformation, on change, be it from the driving seat, be it from the research seat, being in the middle. And that's what I find it also particularly exciting today. So colleagues, we're going to be talking about the what, the kinds of priorities, but we're going to be talking a lot about the how. How do we make a change? How do we transform? So first of all, I'd like to invite Dr. Hans Kluge. Hans, Regional Director of WHO. Such a pleasure to have you here today. Hans, you actually, I learned a lot from you on transformation when we were colleague directors at the office years ago. When you were the director of the Health Services and Public Health Department, you were pushing very much this idea of cross-country transfer, very much this idea of transformation, very much this idea of change. Hans, 2 sets of questions with you, 3 sets of questions, and we have very little time, around 4 or 5 minutes each, so we have to be all very concise. I'm so sorry for that, but I'm sure you guys all are very good at explaining and pack an awful lot on these 5 minutes, and particularly if I stop talking myself. So Hans, 3 things I'd like to talk to you about. One is how from the WHO you see the key priorities that for support to member states. What are the key areas of innovation that member states need to implement, particularly now in times of COVID? Second, very quickly, we want to hear about this Pan-European Commission, which is very much priorities as well as the how we support member states. And third, very briefly, on your thinking on transformation. So shall we start with the first one, Hans, and talk us a bit through what are, from your perspective and that of WHO, the key priority areas to support our member states, particularly now after hopefully very soon the pandemic. Hans.
Thank you so much, Josep, and it's really a fantastic pleasure. I agree with you to be here because, as you say, Josep, I have been involved since 2017. I want to thank respected Professor Walter Ricciardi, who at that time, as chief of the NHS, invited me at the Institute in Rome, remember Walter, where we were exchanging our experiences on the how, agreeing that the what is clear, but we need to crack the nut of the how. And also first my appreciation to Dr. Vesna, Kerstin, Petrič, Director General, collaborating, and in fact, not only in Slovenia, but let's remember that in 1996, Ljubljana was the venue, the birthplace of Ljubljana Charter, which frankly speaking was incredibly visionary if we look what we're going to discuss today. And also my appreciation, of course, to Maya from the European Commission, with whom we have very close collaboration. So I was thinking, Josep, knowing all of you folks, that to put maybe my formal talking points a little bit aside and answer ad hoc your question. Priorities. I would like to refer, Josep, to the WHO European Programme of Work 2020-2025, approved by the 53 member states at the Region Committee last year. And why do I refer? Because, as you know, I had the opportunity as a candidate for my post to go to every single of the 53 European member states with the Belgian ambassador. And I asked the question to the Minister of Health and Minister of Foreign Affairs, what do you think, Excellency, WHO is doing good, should do different, and should be stopped doing? And that incredibly richness was the basis of our vision for health for the next 5 years. 3 top priorities. 1, universal health coverage. And we know that the key issue in Europe is about people being pushed in poverty due to the fact that they can no longer afford to pay for their medicines for non-communicable, for chronic diseases, number 1. Number 2, preparedness of emergencies, and this was before the COVID-19, remember? And the third one, health and well-being. How can we create a culture of health where everyone, independent of race, of religion, of sexual orientation, of financial capabilities, can be empowered to take healthy lifestyle decisions? And only then will be able to do something at the 4 big risk factors, because 9 out of 10 people still die of chronic disease with or without COVID-19. But as you know, in the vision, I put a lot of focus on the how, because I want to be RD Mr. How. So 3 hows. 1, the power of partnership. As you know, I have been working in the most challenging places on earth, including the prison in Siberia, in North Korea, in Myanmar. I have seen the power of positive partnership. I'm very obliged to Dr. Stella Kyriakidis. Straight away, we signed joint statement to work much more better together. Yesterday, I had my regular talk with Andrea Ament of the ECDC, because the EU, and soon under the leadership of Slovenia, is going to develop more the concept of the HERA, of the European Health Union. strong Commission, strong WHO Euro, vice versa. Second, how is country impact? I'm really strengthening the country offices, particularly in the non-EU countries. And I always say, whatever policy comes out of Copenhagen has to make a difference at the country level. We're doing a huge exercise now, country presence review, under the guidance of the Standing Committee of the Region Committee, to see what are some new modalities to support the member states. And one I have tested myself during the COVID-19 is sub-regional modus operandi. Visegrad, Baltic states, Central Asia, where countries really have a similar history, culture, health systems. And third, I strongly believe, and you know this, Josep, because you're part of it, is WHO fit for purpose. And I think that's what the IPPR is telling WHO, co-chaired by Prime Minister Helen Clark and President Johnson Sirleaf, that in order for WHO to reform, we have to do one thing. We have to listen to the healthcare worker. We have to listen to the patient. We have to listen to the frontline workers. So wherever I go to the country, immediately after I meet the president, I go to the primary healthcare center and I have to pick out one priority, because many of you are better versed than me on the lessons learned. It's primary healthcare. Back to the basics. That, and this is the bread and butter of WHO, the flagship of the flagships. Going back to the roots, the Alma Ata Declaration, with a lot of attention to the healthcare worker, the nurses and the midwives. 1 week ago, we had International Nursing Day. And that day, I appointed Maggie Langens as the new Nursing and Midwifery Policy Advisor. And I kept my word to put a lot of attention over there. But finally, not only health, link it to the social care and to the public health services, where we have no better champion than Dr. Vesna Petrič, who always has been at the forefront of linking our health system with the public health and surveillance. Over to you, my friend.
Beautiful, 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 Hans. Clearly, your outline of these priorities chime very much with the kinds of priorities that actually to reach came about, put forward, and you gave lots of granularity to those. I won't repeat what you said. One area you went that I want to highlight because of the importance of transformation, again, an area that you've been leading and thinking about, is the way you group the member states, the way you understand. You highlighted very much in your talk already, Hans, the different cultures, the different contexts, and how you get this translation, this transfer. That's central, and I learned an awful lot from you about that. We're practically out of time, Hans, but I would like, if that's okay, to tell us what the commission you set up in place, the Pan-European Commission on Sustainable Health and Social Systems, which in many ways, it's a how. It's pushing member states to steer things differently, to work differently, to get these key priorities that COVID has taught us about in place. But I should not preempt, I learned that from you, I should not preempt your words, but rather hear why you set up this commission, but more importantly, what this commission very briefly came out with already.
Thank you so much, Josep. Absolutely, trying to be concise, because Professor Mario Monti gave the feedback to the 53 member states at the Standing Committee of the Region Committee. So the whole idea was looking after the financial crisis, and many of you worked with that one. We tried, but succeeded only to a certain stage to put health at the top of the political agenda of heads of state, ministers of finance. So I thought, let's establish a pan-European commission, particularly with former heads of state, former heads of government, minister of finance, to help us to rethink policy priorities in the light of pandemic. And that's, for example, where Professor Monti is putting the preliminary recommendations to the Italian presidency of the G20. And I want to give credit also to Professor Ricciardi for linking there. And further also to the G20 Global Health Summit to rethink these policy priorities. Because we need to convince that level, the other sectors, to create a conducive environment for three things. Number one, more attention to global public goods, and health should be included. Second, financing of health and One Health. One Health will be a biggie because 70% of future threats will be zoonotic infections. And the third one is a new international governance. And that's where and I'm a very happy person because my governing body board agreed to have a working group to work out modalities of a pan-European Health Security Council at the level of the heads of government, reflecting the membership of the Standing Committee of the Regional Committee. So in a nutshell, it's not focused on the COVID-19, but on the health and sustainable development within the Sustainable Development Goals, not to lose. And I'm particularly looking at Dr. Petrič. Our dream here is that we cannot lose this momentum for public health, because no surveillance in the community, right? No public health workforce, we will never be better prepared for any pandemic. So not to lose this historical momentum, and Professor Monti is going to advocate also with Prime Minister Draghi for a G20 Global Health Board modeled on the Financial Stability Board after the financial crisis.
Thank you very much, Hans. Very, very appreciated. We look forward very much to the final report of the Commission, but you already signposted some of the key areas. Let me now move to the European Commission and introduce Ms. Maya Matthews. She's head of unit, head of the health systems performance, country health systems performance. Maya, I'm so pleased to have you here today. Since you joined, I must say, I can see the impact you had on DG SANTE, on a lot of your leadership, on your thinking, and on the range of mechanisms that SANTE, together with other directorates, have been put in place to support member states, on transformation and change and the introduction of innovation. Maya, two areas, and again, it's very unfair to ask you, and I'm running late already, to summarize all of you such a wealth of work that the WHO and the Commission are doing in this field in such a short time. But two areas to discuss with you briefly, Maya. One, the funding, the EU for Health program, which is going to be financing, supporting transformation priorities in key areas, of course, as well the Recovery and Resilience Fund, the beautiful baby we're all looking for, waiting for. That would be the first part, perhaps a bit on the funding, and the second part, quickly, a sense of the wide range of instruments you have to support member states as well. So you can start with either of those, Maya. Welcome, and thank you very much for being here today.
Thank you very much, Josep, and thank you for inviting me to this meeting. It's very interesting. I'm all for innovative solutions, so I'm very happy to be part of this opening session. And I would also like to echo the words of Dr. Hans Kluge that, hearing all of the exciting work that WHO is doing, we're very happy to have such a close partnership and collaboration with WHO. I think I would actually like to start with putting a little bit a sense of the context that we're actually in right now, because I think never before have we seen health systems so high up the political agenda. What the COVID pandemic has done has put all attention on health systems, health workers, and I think my biggest, what keeps me awake at night is how we can harness all of the innovations that have happened in this very short period of time. How we can make sure that these innovations are integrated into more long-term policy directions. And this is where I think that the Commission can help. And I would like to focus in my 4 minutes on two areas where the Commission can help member states invest in health systems, and also where the Commission can help member states reform health systems. So as you said, the investment part, I think, again, with the kind of situation where we've had this pandemic right at the time when the Commission was setting up their next multi-financial framework, we now have a whole battery of instruments which can actually support member states in their health systems. So I don't want to just focus on the EU for Health programme, which is groundbreaking. It's 5.1 billion euros to support member states, stakeholders, to really, as Dr. Hans Kluge said, it's really a partnership-driven instrument. It's really about working together with member states. But we also have other more traditional instruments like the cohesion funds, which are really drilling down into the regions, context-specific, really being able to work with member states in investing in their health systems and reforming them. And then, as you said, we've got, and you all know this very well, the New Horizon Europe, which is really, again, a quantum leap in terms of the research agenda. And then this new baby that we're all kind of working with, I'm very busy with that at the moment, the Recovery and Resilience Facility, which is, you know, the centerpiece of the Next Generation EU. It's really an attempt to, again, boost the recovery of the member states after the pandemic, but with a single goal, and that is to build back better. I know that's become a cliche, but it's really looking at how we can do things better, how we can also transform our economies into digital and green transitions. And I'm very happy that as part of the regulation, health is one of the 6 key pillars. So at the moment in my unit, we are getting and assessing the 18 plans now that have been submitted by member states. And I can tell you that all of them have a health component. In terms of reform, and I realize I'm also running out of time, I will just be very quick because I think many of the audience know very much what we do, but I would like to just maybe focus on 3 areas that I think deserve some attention, and also thinking about, again, how we can use knowledge brokering, for example. You know, we work very closely with you, Josep, in the Observatory, and with OECD in our state of health work, which is really about building robust data, comparable data, to help inform policymakers. And I think, again, with the digital transformation, how can we actually do that better? How can we do it quicker? I know that in my team is very frustrated sometimes that we have to wait so long to get data, that some of the data that we're presenting to you is like 2-3 years old. That shouldn't be happening anymore. We should actually be able now, with all the tools, to really have real-time data, that we can be much quicker and more agile. That's one of the things we found about the pandemic, is that we need to build more agile, more flexible health systems. And I think we need the data to do that. The second thing, of course, is the sharing best practices. In DG SANTE, we've been doing that for many years. Again, with the new EU for Health program, we will have a lot more funding to do that, and we would like to work with all stakeholders to do that. It's again about the how, and let's try and really make this sharing best practice, again, much quicker, you know, find ways of sharing the information, disseminating the information, finding out really how to make that jump from pilot projects to really transferring, scaling up. So there's a lot of exciting work going on. From the Commission side, we are also in this period where we are building a health union. We have policy frameworks now. We've adopted the Beating Cancer Plan. We've adopted the pharmaceutical strategy. So it's really, and all of these, of course, have a very important health systems dimension. So I think in closing, I would just like to say that let's see this tragedy, which is the COVID pandemic, also as a catalyst for really helping to transform health systems and making them more effective, more accessible, and more resilient. Thank you.
Impeccable, Maya. Thank you very much indeed. I recall as well that you wanted to hear a bit more from our participants today about ideas, suggestions for the EU for Health program, and we wanted to encourage them to use the chat, and the College of To Reach will be collecting that and feeding that back to you, as well as to WHO, as to the key priorities that our participants see today. I like the way you brought the baby, the various elements of the baby, which reminds me as well of the European Pan-European Commission and the need to relate health with the clean economy, with environment, with so many areas. And in that sense, the European Commission is an intersectoral organization, and that's really, really helpful. And I wish we had more time, Maya, for you as well to tell us more about the kinds of mechanisms you have in place, the joint actions and so many others to support the member states. But actually now, as we're moving to the next presenter, DG Director General Vesna Petrič, it's already very much an area I'm going to be asking Vesna in a minute. It's very exciting, as I said earlier, that what you are saying today, Hans, Maya, what you're going to be saying, Vesna, I believe, sounds so much music to our ears, to those of To Reach, those who've been struggling for years to get this idea of the how, the transformation, the support, the implementation of change is not only the evidence, but how we support our member states. And we're learning so much about that. And indeed, Vesna Petrič, welcome Dr. Petrič today here to tell us about the priorities of your presidency. because indeed, the presidency is music to our ears. The way you're approaching it, the kinds of priorities I heard you're putting in place are very much at the core of what to reach wants to put on the table. Vesna, can you give us a sense, a bit of the priorities of the presidency?
Thank you very much. I'm very pleased that you have invited me to this session, and I would also like to thank Hans to express his appreciation to what we do here. It's not about me, it's about my country. And I would like to first share with you why that is so that you would understand why Slovenia in its presidency is really focusing that much on health systems. Hans has mentioned that in '96 we had this first ministerial event on health systems, and I think this was also the beginning of observatories for health systems and policies. It was born at that time, if I would say so, because we all realized that we need data and we need to look at health systems appropriately to monitor, to measure how they are and how they could improve is based on all the evidence, of course. But this was not the only conference. We then progressed to Tallinn in 2008 and then 2018. And I think this was really important event in 2018 because from what, as Hans said, in '96 we came to how, and we started to speak about importance of 3 E's. Innovation, investment, and implementation. And Slovenia was really a listener there. It was a sound of music, as you said, for our ears, because we said implementing, this is what is so seriously important. And how we implement is by investing and innovating. But now I think we are at the phase where, from the experience with COVID, where we have realized that not only that COVID, of course, impacted our health systems enormously, but we also realized that there's a lot of potential and flexibility in our systems when they need to adapt. So it's not as we thought before that you need ages to change things, but if you really invest and if there is a lot of political will, you can really adapt much faster, and our health systems indeed are quite flexible. And I'm sitting in a country where primary health care is actually at the core of the health system. We have invested since, I would say, even since 1920s in our primary health care system. And this has proven to be something that was really helpful during the crisis, but also during the COVID crisis, because locally based, close to people system, which is primary health care, and very much working together with local community and focusing on vulnerable populations. This is what we have done so far, also with quite a lot of investments from the funding that is available at the Commission, has proven to be the right direction during the COVID. And now the next step that we see is, and I will use the word that was used by Professor Monti for the Monti Commission report, is integration. And if I translate this word integration, for us it means collaboration, looking for synergies, complementing, looking how policies could complement each other to better sort out problems that are there in the health systems. And now I'll stop here, and I said that all this is a basis of what we want to do during our presidency. We intend to look at how we could better invest in innovation at the EU level, because this is, of course, presidency of EU, to support and strengthen our health systems, if I say together. There are lots of mechanisms that are available, and Maya was talking about them within the health, within the EU and within the EU Commission, in different parts of Commission. It's not only the health part, it's all the parts of Commission, like, those that are dealing with digital, the reform one, and so on. So there are different parts of Commission. They all are potentially investing in health system, and there's a lot of preparedness already there. There are plenty of mechanisms, even financial mechanisms, that can be used. But what we would like to do during our presidency, we would like to look in specific how to better use these mechanisms to more strategically at the European level invest in innovative solutions. And here I'm speaking not of innovation only, technical innovation and innovation in medicines. This is also important, but I'm speaking also of innovation in how our systems are organized, how they are financed, how and what we do with our human resources. The workforce that was mentioned by Hans is also very important, and we are believers of working together. There are several reasons why Slovenia is so eager to work together at all possible fora, including, of course, WHO, which was mentioned before, but also in particular in EU, is because when you are a country as small as ours with limited capacities, you very soon realize how important it is to open up and to work with other countries and try to develop solutions that are based on different experiences, because very often when we look at how others approach a certain problem, we get a lot of ideas how we could better approach our own problem. And this has been realized in an occasion, a very specific occasion, where Slovenia and Italy and Austria have met together to discuss primary health care and improvements there and how to strengthen primary health care. I mean, Austria has really done a great work afterwards, but it was based also on what they have heard that we are doing in Slovenia, where we put a lot of attention to the preventive services, which are part of services that are free of charge available to people in healthcare centers, but also Italy, that was focusing a lot of very much on how to integrate services at primary and secondary level. So all this was an input for Austria, but we have also learned a lot from others, for example, in how to manage best health practices that, people working there are motivated and can work much better. So this kind of exchange is really important, and this is why we believe we could open the floor for the discussion during our presidency, how we could at EU level do this better and use the available resources for such a purpose. And of course, we would like to build on the initiatives such as to reach and perhaps also a new partnership on transformation of healthcare system is one of the opportunities. Here I'll stop because I think that I've said enough. Maybe Joseph will have some additional question, but during our presidency, we will actually be very happy to hear also from others how they see this opportunity to COVID is definitely for us an opportunity, to work even better together at political levels, because this catastrophe has actually, as has been said before, opened the floor much higher at political level as it was so far. So this is an opportunity to really look at it politically, not just technically. And in doing so, I think we will be able to cooperate much better in the future.
Perfect, Vesna. I'm so grateful. Almost today, it sounds too good to be true, because we talked about music today, and you're really singing from different perspectives the same tune, very much aligned, very much tune and tone together. Clearly, Vesna, you you, I must say, as well as Slovenia, you and your country have been at the cutting edge of many of these thinking on transformation, on change, and supporting reform from the Ljubljana conference times. And now again, with the European Commission, with the presidency, you'll be leading member states coming together, learning from each other, and helping people like Maya, if I may, Maya, and colleagues in the Commission, to put together the beauty, the range of instruments they have across directorates. And indeed, also with the participation of WHO, I believe that you'll be working with the Commission on your conference, Vesna, and then you're inviting as well other stakeholders like WHO to try to bring that elements together. You talked about primary care, you talked about integration, you talked about Monty, very much echoing the views of Hans and Maya earlier on. I would love to continue with that, Vesna, but I'm running really, really late, among others because I talk too much myself. I apologize, but that was absolutely perfect. And we look so much forward to your presidency and to learn about these instruments and how in practice we do work together. Last but not least, Professor Walter Ricciardi. Walter, thank you very much for being here. Thank you very much. You're the principal investigator with your former institution, also the Istituto Nazionale Superiore di Sanità into REACH. You, as I said earlier, Walter, have this double dimension as a researcher, as a key researcher, academic, but also you've been in the Istituto Superiore, Universidad Católica, now in the cancer, president of the cancer research group we have by the European Commission, very much at supporting priorities, at introducing new priorities and supporting our policymakers. Where do we go after that, after to reach, Walter? What are the key priorities that COVID has taught us that we need to be doing some more research, both on the what and on the how? How do you see that moving together? What do you want from the member states? What do you want from the Commission? What do you want from WHO?
Thank you, Joseph. First of all, I would like to thank you, the panelists, but I want really to thank all the organizations and individuals that have participated in this great project. We shouldn't forget what we have achieved in these years. When we started, health services and health services research was the kind of a Cinderella, you know, of the research field, was ignored by most, was unknown by many. Now everybody, even with the COVID experience, understands the importance of health services and of health services research, understands the fact that in the world, the difference in the result and at the end of the day in lives and deaths, it depends on the capacity and the ability of health systems to reply. It's not, the virus is pretty much the same all over the world, but in countries that were better prepared and were based the decisions on the evidence, of course, the results were much better. So now for the future, we have to incorporate stably this kind of approach. And is what we are doing, for instance, in the Mission Board for Cancer. In the Mission Board for Cancer, we have expressed 13 bold recommendations for the European Commission and member states. And they are substantially on the work carried out by to reach. So the big determinants, of course, are outside sometimes of the health sector, but the reply stay in the health sectors. And just to give you an idea, the way to standardize it, to exchange the best practice is encouraged to become the more stable way to run the systems at national level. So if I have to answer your questions, Josep, is to make this stable, the new normality, not a kind of, you know, accidental research that is carried out as a kind of cherry on the cake at the end of the project. This is really something that has to be incorporated in the actions, and actually it is, because what Maya said, what has been said previously, it goes exactly in that direction. It's also very well shown by the availability of member states to create new partnerships. It's the openness and availability of the European Commission to fund the many actions in these very deep roots. And I think we can be very optimistic for the future, because the work that we have done has really paved the way for a new future in which, with the universal values of the European Union, we can really make an example for the world. Last but not least, I want to remind that the To Reach involved also the USA, Canada, and Israel. And I know for sure, and I think Arlene will confirm, that also in those countries, To Reach have had some important effects, particularly in time in which the administration, in particular in USA, was not exactly fond of evidence, of scientific evidence. But that was the possibility for researchers, scientists, health services, people to resist and now to look at the future with very strong optimism. Thank you very much.
Perfect. And I see now on the screen Dr. Gustafero, who will be speaking later on, to thank him very much as well, because you continue with the leadership of this project, Silvio, of To Reach. Thank you very much, Walter. I would love to engage you on some of the new priorities, on some of the work that you are putting on cancer and so on. But we need now to move on. But you made it perfectly well, as always, Walter. You were talking about the new normality, and today it felt almost, and I hope it's true, Walter, as there is a new normality when the leaders of these organizations, when the leaders of the next presidency are talking about these topics as if that was at the core of the priorities of the research, of the work. It feels terribly good. And I do hope very much this is new normality. We'll be hearing now in the next sessions more about the research on the how, more on the key priorities. We'll have more time to debate these areas. And at the end, we'll be hearing from RTD, we'll be hearing from colleagues about how we keep financing, finding resources to support these areas of research, and particularly not the research only on the areas, but on the how, evidence on the transfer and so on. So thank you very much indeed, panelists. You've been absolutely great. I thank you very much. You've been a perfect opening to get us excited for the next sessions and to go in more detail. And I give the word with my apologies to George. Sorry, George, I've been a bit late, but I couldn't stop my panelists. They were too good to stop them. George, the panel is yours now.
Josep, thank you very much. And thank you to all of the speakers for your generosity of time today and the great insights that you shared with us. We have no concerns about time. We've built in some places to save time later. So everyone, thanks so much again for what you've said. What I'll say to the audience is that you've got plenty of opportunity for questions and answers. So if you've got any questions that have come up from these panels, we can help answer them a bit later you can type them into the Q&A box at the bottom of your screen. And you can do that throughout the rest of the session. So Josep and the rest of the speakers have just really helped us understand the context that we're working in and what are some of the challenges and opportunities. And now the next two sessions are going to look at really the how of the policy briefs. So I talked earlier about the policy briefs that have been published today. If you're following To Reach on social media, you'll see the links to be able to read these two policy briefs that were published today, or you can find them on To Reach, the To Reach website.